The first thing that women need to know is that they are at higher risk of having a stroke compared to men. Women tend to live longer than men, therefore we're at higher risk just by age alone. If you're older than 65, your risk for stroke increases. We know that when a woman has other conditions, such as atrial fibrillation, they are at higher risk of having a stroke. So any woman should be looking for what risk factors they have that increase the risk for stroke. Do you have high blood pressure? You have high blood pressure, you know you're at higher risk for having a stroke, therefore you should seek medical attention for that. Do you have high cholesterol? Are you diabetic? Do you live a sedentary life? We all hear about my neighbor had a stroke, my family member had a stroke, this person had a stroke. And I know that some of us are capable of recognizing some of the symptoms when a patient had a stroke. I think that it's easier when there are obvious signs like I cannot talk, a part of my body is weak, or I have a droopy face, versus more subtle signs of a stroke, which can be like a short-term lapse memory, all of a sudden I didn't remember, or short-term vision loss, where transiently I didn't see well, but then because it didn't last, I didn't pay much attention. Stroke is a lack of blood flow to a part of your brain, and that lack of blood flow, it can be because of a clot that occluded that vessel, or because of bleeding, the rupture of a vessel that is not letting the blood flow get there. The brain needs nutrients, needs oxygen. It's a very vital organ, and seconds of not having those nutrients or oxygen that needed to be delivered there can translate on death of that tissue, which subsequently gets manifested with deficit that we can see in our patients. I think that more important than anything that we can do to identify or treat a stroke is how can you prevent a stroke. And knowing if you have any of the risk factors that I just mentioned give you the power to recognize and be proactive in preventing or treating them. Around 5 million women live in this country with consequences of stroke. So if you know your risk factors and you are proactive in identifying them, that will help you be away from that statistic.